Central Illinois is the CI in CI Living.
Caring for a loved one facing a health battle isn't easy. It's important to know it's okay to ask for additional support for your loved one as you, the caregiver. Today's CI Health sponsor is Transitions Hospice. Kuljit Kapoor, the Chief Medical Officer, is joining us now with a little more insight. Welcome.
Thank you very much for having me.
Okay, so tell me all about Transitions Hospice, because I think a lot of people, when they hear hospice, it's already like kind of a negative connotation to it. And it's sad.
Right. And a lot of people do ask me, do you go home and cry every day? Oh. But I really emphasize that, it is such a rewarding, a part of life that we offer, this end-of-life care to patients. And there are end-of-life experts that are focused on prognosticating, or that basically means determining based on the advancing illness somebody has when their life may come to an end, and these are always estimates. And Transitions Hospice is the wonderful hospice company that I work for, and I've worked for a few, and I think that it's such an amazing company because we offer not only the palliative care arm so that we can do supportive care for people who are pursuing aggressive treatment, as well as patients who may not be quite ready for hospice, but we also offer the hospice arm, which is the end-of-life care. Now, in this country, the time to death when somebody does come on to hospice is about 9 days to death, which is really sad because that means we're not educating our providers and our families early enough about the disease process. And that means that we're not getting them into the right type of care at the right time. So I really, emphasize that we should get palliative care started, which palliative care is different than hospice.
Okay, explain that.
Yes.
What is the difference between the two?
Yes. So not only is the coverage different, palliative care is covered by Medicare Part B, whereas hospice is covered by Medicare Part A. So palliative care is what every good internist or primary care doctor essentially does in their office. It's starting to determine the goals with the family as the patient ages or gets diagnosed with an advancing illness. And then after that point, we start, then in the outpatient setting, palliative care can extend with a company like Transitions, right? So then you would put in the referral. When you start seeing that a patient's going into the hospital more, they're falling more, we need to start thinking about whether that hospitalization is really helpful or not. And so then if the patient has more visits in the home with a palliative care service, it prevents that readmission to the hospital, which, every palliative care consult is going to save $3,000 to the healthcare entity by getting to that CHF exacerbation before it happens, because we see them in the home setting. And we do it really well. We're very high quality. We're looking at all the metrics, and our nurse practitioners are trained, in the latest progressive, evidence-based medicine.
Well, it's nice to know that there are options when it comes to hospice care, because usually you just assume it's with the hospital or whoever the caregiver is being seen, the doctor. But you're an option for people to have come in and help.
Yes, and so palliative care is going to be a nurse practitioner and or a social worker that's going to be seeing the patient 1 to 2 times a month, but we will always see the patient more if needed. Whereas hospice, you're going to have a team of professionals. That's the point where the patient says, less is more. Going into the hospital is not really helping me. I've been optimized on my medical management, and I really want to be at home, or whether they're in a nursing facility or home or wherever they are. And there's different tiers of support that are offered within hospice: acute crisis care, there's general inpatient level of care, there's continuous care. If I have a patient that's in really bad pain, that patient can be, we have a skilled nurse that will go and stay with them for, however long, maybe usually about 2 to 3 days, to get that symptom under control so I can know what the medication changes are. And then where there's routine care. Yeah. So you get a chaplain, social worker, you're going to have a physician that's on call 24 hours, you're going to have a nurse practitioner, you're going to have a nurse, and the aides. So you just get more support. But some people are never ready for hospice, so we still can take care of them on palliative care as well, with maybe a home health company involved to fill in those gaps.
Well, I feel like we could talk a little bit longer about this, but unfortunately we're out of time. But it is good to know that that is an option for families out there with loved ones who may be nearing end of life, and to help make things, ease the burden on the family and the patient. And we appreciate you coming in.
Thank you for having me.
We will definitely share all of this information on how you can connect with Transitions Hospice to their Facebook, their website. They're at CILiving.tv.